We are going to discuss the muscles of mastication in this video. From the superficial to deep aspect, they are the masseter, temporalis, lateral pterygoid and medial pterygoid muscles. Before going into the details of the muscles, we have to understand certain anatomical landmarks to understand this topic very clearly. This is the lateral view of the skull. So, this will be the inferior temporal line, this will be the superior temporal line, and this region will be the temporal fossa. This is the zygomatic arch. It is formed by the zygomatic process of the temporal bone and temporal process of the zygomatic bone. This part of the maxilla which lies near the zygomatic bone will be the zygomatic process of the maxilla. This is the mandible and this is the coronoid process. This will be the condylar process. This region is the ramus of the mandible. This is the angle of the mandible and this will be the body of the mandible. This will be the region of temporomandibular joint. This is the view of the skull from the lateral aspect after removing the zygomatic arch in this region. So once we remove the zygomatic arch, the area that get clearly defined are the lateral surface of the lateral pterygoid plate, and this will be the greater wing of sphenoid, and this is the infratemporal crest within the sphenoid bone. This is the inferior view of the skull, and in this region, in relation with the muscles of mastication, we have to identify the medial pterygoid plate, the lateral pterygoid plate, the scaphoid fossa over this region, the pterygoid fossa over this region, and the pterygoid hamulus that arises from the medial pterygoid plate. Then also here will be the groove for the eustachian tube. Now we will be seeing the muscles of mastication one by one. The first one, masseter. Here is the masseter muscle. It is very clear that it is not arranged in a single plane. It is a superficial plane. It has a deep plane. Let's see the details. It is a quadrilateral muscle and it is situated in the borderland between the face and the parotid region. The masseter consists of three layers of fibers: the superficial, middle and deep. All the layers are blended in front. Now we are going to see the attachments of the masseter. The superficial layer takes origin from the anterior 2/3 of the lower border of the zygomatic arch and the adjoining region of the zygomatic process of the maxilla. The fibers pass downward and backward at an angle of 45 degrees and are inserted into the lower and posterior part of the outer surface of ramus of mandible. The middle layer arises from the deep surface of the anterior 2/3 and lower border of the posterior 1/3 of the zygomatic arch. The fibers pass vertically downwards and are inserted into the middle of the mandibular ramus. The deep layer arises from the deep surface of the zygomatic arch and is inserted into the upper and anterior part of the lateral surface of ramus of mandible, including a part of the coronoid process. The middle and deep layers together cross the superficial layer in X-like manner and form a cruciate muscle like this. The nerve supply of the masseter is by the masseteric branch of the anterior division of the mandibular nerve, and it supplies the muscle from the deep surface. It is a strong elevator of the mandible and the superficial fibers help in protraction and deep fibers help in the retraction of the mandible. The tonic spasm of both the masseters is the characteristic symptom of tetanus. The condition is known as the trismus, which produces locked jaw. The next muscle among the muscles of mastication is temporalis, that is this muscle. As you can see, it is a fan-shaped muscle, arises from the floor of the temporal fossa below the inferior temporal line and from the overlying temporal fascia. You can see the temporal fascia over this region, it is removed over this region. The bony and facial origins give the muscle a bipinnate appearance. The fibers converge below to form a tendon which passes deep to the zygomatic arch. To see the insertion better, we are going to remove the masseter muscle. The masseter muscle has been removed in this diagram. Now we can see the insertion of the temporalis very clearly. It passes deep to the zygomatic arch and it is inserted to the coronoid process of the mandible or this region, involving its tip, the medial surface and anterior border, and also into the anterior border of the ramus of the mandible, a little bit here. The nerve supply of the temporalis is by the deep temporal branches of the mandibular nerve. When we look at the action, it elevates the mandible and is associated with the speed rather than power. Its posterior fibers help in the retraction of the mandible. Temporalis muscles of both sides are involved in side-to-side movements. Now we have to see the remaining two muscles. In order to see that, we have to remove the zygomatic arch and a part of the temporalis muscle. This is the view after removing them. We are going to see the lateral pterygoid. This is the lateral pterygoid muscle. It is the key muscle of its region because of its important relations. The lateral pterygoid arises by two heads, upper and lower. The upper head arises from the infratemporal surface and infratemporal crest of the greater wing of the sphenoid. The lower head, it arises from the lateral surface of the lateral pterygoid plate that we have seen in the beginning of this video. Both the heads proceeds backward and laterally and converge to form a tendon which is inserted mainly into a depression in front of the neck of the mandible and partly into the capsule and articular disc of temporomandibular joint. This is the temporomandibular joint. Here you can see the capsule and here is the articular disc. The lateral pterygoid is attached to it partially. Nerve supply of the lateral pterygoid muscle is by a branch from the anterior division of the mandibular nerve. Regarding the actions, it helps in opening of the mouth, or other words depression of the mandible, by pulling forward the head of the mandible together with the articular disc. Combined actions of lateral and medial pterygoid muscles of both sides protrude the mandible. Upper head helps in chewing and lower head helps in protrusion. When the lateral and medial pterygoid muscles of one side act alternately with the other side, they produce side-to-side chewing movement. The relations of the lateral pterygoid muscle are very important. We are not going to deal those in this video. The link for the relations of the lateral pterygoid will be given in the description part. The next and last muscle is the medial pterygoid. This is the medial pterygoid. It is a quadrilateral muscle and consists of a large deep head and a small superficial head. The superficial head, which is visible over this region, it arises from the tuberosity of the maxilla, which is over this region, and the pyramidal process of the palatine bone, which is lying in a deeper aspect. In order to see the origin of the deep head clearly, we are going to look the skull from the posterior aspect. Here it is. This is the medial pterygoid plate. This will be the pterygoid hamulus, and here is the deep head of the medial pterygoid muscle. So as you know, the lateral pterygoid plate will be present over this region next to the muscle. So the deep head arises from the medial surface of the lateral pterygoid plate that you have seen in the beginning of the video, and the fibers of the both heads, so both the superficial and deep heads, they pass downward, backward and laterally and are inserted into the medial surface of the ramus and the angle of the mandible below and behind the mandibular foramen and mylohyoid groove. The nerve supply is by a branch derived from the trunk of the mandibular nerve. It assists in elevation of the mandible. In combination with the lateral pterygoid muscle, the bilateral and simultaneous contraction help protrusion, and alternate contraction produce side-to-side chewing movements of the mandible. So generally, the three muscles, that is Masseter, Temporalis and medial pterygoid, elevate the mandible to close the mouth. Since all of them exert anti-gravity action, they produce rough markings or projection affecting the ramus of the mandible. Among the four muscles of mastication, only the lateral pterygoid causes opening of the mouth or depression of the mouth. There are other muscles, other small muscles which assist in the mastication process, but when we look at the muscles of mastication, these four that we have discussed in this video are the important ones. The peculiar nerve supply of the muscles of mastication denotes its developmental source. They are derived from the first pharyngeal arch, so they are supplied by the branches of the mandibular division of the trigeminal nerve. So this was in general about the muscles of mastication. This table shows the details of muscles of mastication in a nutshell. So that was all about it. Thank you for your patient listening.